2 months ago, my back slowly gave up. Kind of stayed. I thought it's gonna go away for a while. It didn't. Then I've done 2 PRB, and Thursday I did stem cell. But I mean, I'm getting better, but it's very slow. I'm not sure if I'm supposed to get better faster or since Thursday I'm kind of going backwards now.
So right now we're doing instrumentation to look for, is there any abnormal difference in temperature? And we spot one right here. So when a patient talks about, a lot of sharp low back pain and sciatica, and we saw earlier, evidently he's also limping. Just looking right off the bat here, there's a lot of swelling in this region over here. So the body's trying to protect something and stabilize this area over here. So we're going to take a closer look, see what's going on over here. So when I challenge on this one, this is your 5th lumbar. How's that? Any pain?
No.
No. And that's very interesting because people with sharp sciatica pain and a potential herniated disc, it should be a lot of sharp localized pain. Unless the patient been taking a lot of significant painkiller medication. Have you been taking anything in the past 12, 24 hours?
No.
Nothing. So that makes this even more interesting. So we're going to take a closer look elsewhere what's causing this low back pain and the sciatica, since it's not the typical 5th lumbar problem. So let's go ahead and look a little lower. How does this feel over here? Huh?
Yeah, I have the big pain on this side.
A lot of big pain over here?
Yeah.
When I push on this?
Yeah.
So this is sacrum, or more precisely correct. This is the 2nd sacral segment right there. So a lot of pain right there, correct?
Yes.
All right. Let's take a look at everything else. No problems, anything else?
No.
All right. Any other pains? Nothing else, right? All right. Let's go ahead. Let's take a look at the imaging. So when we took a look at your MRI itself, you see this over here?
Yes.
That's a disc herniation right there.
Okay.
Meaning, what you're seeing is normal, shouldn't be anything over there. And yet, in your case, did like this, extruded outwards, to the point that now it's putting a lot of pressure onto the spinal nerve. In addition to all the swelling around it, also is what's pinching that nerve. That's what you're feeling, that sciatica going down your right leg, causing all that numbness there. Now, as we mentioned before, and we checked it on you, we challenged this fellow over here. And for any other person, it should light you up, meaning says, ow, yeah, doc, that's a lot of pain right there. But yet, in your case, nothing. Now, you also mentioned that you didn't take any pain medications. Nothing. So that's the only other situation that would cause no pain there. Right? So therefore, we have to look elsewhere what's actually causing your problem. Now, anyone else, when they take a look at an MRI like this, especially an orthopedic surgeon, they'll say, oh, there's a problem right there. We got to operate. And yet, when we challenged over here, the 2nd sacral segment, you said, ow, that hurts over there. There is no disc herniation over there. And yet, when we take a closer look right over here, what I mean by is this: when we're first born, the sacrum itself is actually 5 pieces, and it steadily fuses into one bone as we reach somewhere between 30 to 35 years old. In your case, unless there's some kind of trauma you experience, and in your type of work, especially as a truck driver, it could potentially knock it out, and that's what happened over here. So we have a residual disc between your 1st and 2nd sacral segments. So this got knocked out of alignment, and as a result, because it's a foundation to all the structures above it, it became unstable. This fell over here, blew. So we already found the real problem is actually here, not here. That's the one we need to correct on you. And that's what I also see here on X-ray as well. Same deal. The 2nd sacral segment, this component over here, not this. Even though, yes, I understand, you feel a lot of sciatic pain. And the MRI shows a very big disc herniation right there. But that's not what the problem is on you right now. We have to address this. Do you understand? Exactly. So let's get to work. Let's fix that. Let it go. Let it dry. Let it more. Set this pillow. Okay, coming up. Okay, walk around. Keep walking.
I don't feel anything.
Come again?
I don't feel any pain anymore.
I just want to be clear. You said you don't feel any more pain?
Yeah, I don't feel any more pain. I used to feel it all the way up.
Okay.
He's shocked.
I think you're more shocked than he is. Okay, so.
I used to feel it all the way up
Uh-huh.
when I was walking.
Uh-huh.
But I'm kind of got used to it now. For almost 2 months, I go sideways. I don't go straight anymore. But
You keep going straight.
yeah, I
He used
don't-
to feel when he stretched his leg,
Mhm.
it hurt. It felt a lot of pressure. Huh?
So you also mentioned about numbness. as
Numbness,
well.
yeah.
How is it now?
Now I have a little bit here, but from here, it's gone.
So now you got sensation back in there?
Yes, and
Understood.
I can get down
Mm-hmm.
to my leg.
He's been living with this for 2 months, and now you cannot believe it, right?
No, I cannot.
Well, believe it, champ, because it just happened. Oh, you're welcome.
Uh,
Look at you, Mr. Speedy.
do it again.
Do it again.
I haven't seen him walk like this for a month, over a month, right?
It's better.
Much better?
Much better. Can I get back now to my normal life?
Now, as we mentioned before, because that second sacral segment just fell over here, got knocked out,
Okay.
it's very difficult to heal up. Now, because the special way I corrected it, as long as you follow our recommendation, it's going to heal up very well, and within 2 to 4 weeks, you will go back to all your activities.
Okay.
However, if you knock it out a second time, it's going to be much more difficult to heal up.
Mm.
No different from, let's say you cut yourself. What happens? We form a clot, right?
Yes.
So, you and I both know what happens when we're kids, when we start picking off that clot.
Yeah.
What happens? And what else happens? Doesn't it get worse, right?
It starts from the beginning.
Well, not only that, but doesn't it get worse?
Mhm.
Yeah.
And it leaves a scar,
Scar, yes.
right? So, if you knock this out a second time, instead of 2 to 4 weeks, we're looking at 3 to 6 months to try to heal it. So follow our recommendations. Don't try to knock this fellow out again, and you could go back to doing your regular activities.
Thank you.
You're welcome. Any other questions?
No.
All right.
I feel like $1 million already.
You feel like $1 million, buddy. Thank you very much,
It's
Jack.
been
I'm
a
very,
while.
very-
It's been a while. I couldn't walk. I forget to walk and I couldn't stand for a while.
And also keep that in mind, that fifth lumbar disc herniation, they could have operated on the wrong spot.
No, that's what we thought the problem was. Really.
Yeah, but it wasn't
I
there.
guess it wasn't that.
That's why precision matters.
Mm.
Thank you, Doctor.
And a good
Okay.
doctor like
Thank
you.
you.
You're welcome.
Thank you.